Hello, my name's Chalon Yi, bringing acupuncture mainstream, one talk at a time. Let's talk about something that every acupuncturist needs to get really good at, and that is managing patient expectations. Okay. Now, acupuncture is not a cure-all for every single person in the same way. Everybody's different. Everybody's cheese different, and sometimes you get an immediate response and sometimes you don't. And so you need to spend some time to talk about this to get the patient's expectations more open to what the process actually is for them. Okay, I've had people that come in with 20 years of pain, 20 years of back pain, and after one treatment, they had 2 to 3 months of relief, significant relief. Didn't mean the pain went away, and they really should have come back because they felt so good they didn't need to come back. But I strongly recommend that even in this case, that's great. The guy went out for 2 to 3 months and the pain didn't come back that strong. But you really need to follow up in a week in that particular case. Even if you have a relief, you should come back in a week because you've reduced the inflammation in that particular part of the body, let's say the lower back. But you need to keep on working on that inflammation and circulation problem to beat down that condition so it is harder for it to come back. Okay, and another example, someone comes in with chronic neck pain and you're just constantly bothered by it. Okay, turn their head, oh, pain. Let's say you do a treatment and that person, you need to tell them, okay, I need you to come back, let me know how you feel as the week progresses. And if, for example, in 2 days, pain starts coming back, hey, come on back for another treatment. In that particular person's case, that's the best thing to do. Don't necessarily have to wait a week. And hopefully your schedules open up, you have openings, that person can come in and get another treatment and see if you can control the condition and to help it settle down. Acupuncture reduces inflammation, helps regulate blood flow. So as the inflammation goes down, the recurrence of that problem will take longer and longer until you stabilize it, and perhaps the body can go in there and start defeating that condition on its own or manage to control it on its own. And so a good rule of thumb is when a patient leaves your office, and especially they have relief, ask them to let you know when that pain comes back. Let's say they schedule an appointment for a week and then their pain comes back in 3 days and then they don't tell you. Really they should come back in 3 days and get another treatment, because it's not just automatically eliminating that condition that acupuncture is helping with. Now it could be a combination of acupuncture with some massage or deep massage, or in Chinese they call it tui na, it's like body massage. It could be a little bit, they could be working in conjunction with a physical therapist or a chiropractor or what have you. But all of these can have a very synergetic effect on the patient. But let's just look at acupuncture by itself. The practitioner and the patient, they need to communicate. 1 week doesn't always work for every patient, and you're trying to control that. You're trying to get better control to stabilize the condition that's been bothering them. Someone torques their back. They slip a disc, right? I'm not sure there's a medical term for this. Herniated disc. You can get a very quick relief with acupuncture, maybe over 60% relief in one treatment. It might have to be a strong treatment, but you can get significant relief after one treatment. Does that mean the person shouldn't come back in? No, absolutely not. They need to come back in because, once again, you got to beat down that condition and control that pain even more. Get it from a pain level 8 down to a pain level 4 or down to a pain level 2 to the point where they're not really bothering them anymore. So the general rule of thumb, manage expectations, and you have to communicate with your patient. Tell them that not everybody's the same. Your condition's been there for a long time. We hope that you're going to get more relief through the week so that when you come back, you're not in as bad of a condition as you were before. But you can't guarantee that because everybody's different. You know, the needles will have a different effect, similar effect, but different from person to person. So go into your appointment knowing this and cooperate with your good acupuncturist so you can get the most effective treatment. So it takes a lot of communication. It's a lot more, it takes a little bit more art, a little bit more communication than just taking a pill. And so be educated when you go into the office like that, so you give acupuncture a chance with your good acupuncturist, putting the needles in, trying to do the work, trying to get your body to help itself heal itself. So this is Challen, bringing you acupuncture one talk at a time. Acupuncture mainstream, one talk at a time, and I'll see you in the next video.